A wonderful welcome to all of you. Welcome back to our video session. This is you and your fertility, of course, proudly brought to you by the Love Foundation. I am still Dr. Love, and it's so good to have you here in the new year. This year, like we have said in our introductory video for the year, we have a lot planned for you, our viewers. We just want you to sit back and continue to enjoy all that we bring to you. So we are resuming our lecture series, yes, our vlog, where we talk about various subjects pertaining to fertility. And today we are having a very interesting one. Today's title is Timing for Fertility, Timing for Conception. Timing for Conception. What is the right time that a woman can get pregnant? When is the right time that a couple can meet and be able to achieve pregnancy? A lot of people have it as a practice to just check their calendar, do their ovulation kit testing, and then plan it and try to meet at that time that their kit or their calendar tells them that it is the right time to meet. Is that right? Medically, it is wrong. We have advised couples who are trying to do their best to meet at least 3 times every week. We have said this on this platform before. If possible, every other day. The reason is because there are so many other factors that influence a woman's cycle. When a woman ovulates, when a woman begins to see her period, what happens in the course of the cycle, those details are influenced by other factors like what is happening around the woman, illness, stress, diet. All those things influence the cycle of a woman. So yes, granted, everybody knows that a woman starts her cycle with the menstrual flow. After the menstrual flow, we have the period. That period of menstrual flow is happening in the follicular phase as of the woman are beginning to mature, they're beginning to grow, and at the peak of their growth, ovulation is supposed to take place when the egg is released. Now, we have also said at this platform that when the egg is released, it has about 24 hours to be alive. We have also said, and we have also thought, that a man's seed is able to survive in the woman for a minimum of about 3 days, so 2 to 5 days on the average anyway. So we give that window that if there is regular intercourse, anytime that sperm cell is available in the body of the woman and ovulation takes place, it should be able to see viable sperm cells available. That is what the correct practice should be. So because your kit and your calendar might not take cognizance of the various factors that can affect or influence the entire cycle as to when exactly ovulation takes place and things like that, it is important to meet regularly. We said that we cannot define infertility for a couple who have not met the criteria of meeting regularly, and we have said that is about 3 times every week. But under normal circumstances, that being said, a woman can only get pregnant within her ovulation period. Outside the ovulation period, pregnancy should not occur in a woman, because it is the egg that is released during ovulation that is going to attract the sperm cells and form an embryo, and pregnancy can begin. So it is also very important to try to understand your body. Above using of kits, above checking your calendar, above checking the dates, understand the symptoms that your body gives to you. So menses starts. After that, we have said there should be some days of dryness, after which some wetness starts. That period of wetness that begins indicates that ovulation is around the corner. Being able to tie those symptoms, you can either tie it to the timing, or that's your calendar date, or to your ovulation kit testing, whatever the methods you want to use. But being able to understand the symptoms that your body gives to you is what is very key. So marrying that, the symptoms your body gives you, and meeting with your partner, especially more specifically around that period that your body gives you the signs of ovulating, is key to achieving pregnancy. And being wise enough to ensure that nothing stops you from meeting at that point will help pregnancy to be achieved better. Remember, we have taught here also that yes, pregnancy is supposed to happen every time that these conditions are there, but there are other influences. What is your mood like? What are your emotions like? What are you eating? Are you well supplemented? Does your body have all its needs or all it requires to be able to form and sustain life? So it is important to look at all of this in the broad perspective. It's not just enough to be checking calendar, checking dates, using ovulation kit to know when to meet, know when pregnancy should be happening. No. Pregnancy is a holistic thing, and it involves the entire body and should be approached in a holistic manner. We will be stopping here today. Remember, like our videos, make comments, follow us on all the handles. On YouTube, we are at love_foundation, Instagram love_foundation_, Facebook waiting to conceive. Join our WhatsApp community by sending a request to 08175629809. Watch out for all that we are bringing to you. We have so much that we'll be revealing in the course of this month for the year. Once again, we say thank you for staying with us. Keep watching, keep learning, learn to teach others. Enjoy the rest of your day. Bye-bye.